Hi, this is Mary Cernava, and I'm going to discuss pain management. The purpose for this program is to provide evidence-based information to the healthcare workforce that aligns with the organization's mission, goal, and vision. Understanding the bigger process in pain management, the involvement of the stakeholders, and the effect on the resources needed to achieve excellence. The program objectives are to engage the staff by partnering in strategies to improve outcomes in pain management, provide framework that identifies barriers, implements interventions, and supports the workplace environment to sustain in process of pain management. Collaborate, document, and assess. The SWOT analysis can assess the staff awareness of cancer pain and its treatments, finding the strengths and weaknesses to improve the process by partnering in collaboration to achieve the safety, quality, and satisfaction for the workplace environment. The SWOT analysis will determine compliance issues in the organization, providing strengths, weaknesses, and opportunities and threat. SWOT analysis will assist in the structure planning to evaluate the factors identified to improve quality and safety. Transformational leadership can inspire with a vision, encourage, and enable nurses to develop knowledge and skills to act autonomously. The Lewin's change theory appears simplistic but has the structural development to provide process changes needed to meet the organizational needs to become sustainable. In order for the change to occur in the organization, the nurse leader needs to prove that there is a need. This is called the unfreezing phase. The unfreezing was demonstrated with the DNV assessment in December of 2016. It showed that the change was needed because the documentation for patient pain management was not reflected according to the organization's policy. This prompted my presentation to provide staff with evidence-based strategic plan to improve the process to earn the accreditation and improve patient safety and satisfaction. This presentation's intention is to demonstrate the safety and quality of care validated through the documentation and improvement of reimbursements to meet the organization's financial responsibility and resources. The impact of the plan affects the stakeholders, who include the board members, patient, family, and community. The nurse leader utilizes the standard of practice to assess and identify the issues in process to improve the outcome. The Center for Disease Control discussed that the opioid disorders are overdose, overuse, and underuse. The challenge is the consequence from the lack of documentation and follow-up assessment. A significant challenge is the staff's perception and prejudice. Interventions start by believing the patients and the family reports of pain and what relieves their pain. This is the need for collaboration of the healthcare team to treat the pain, provide treatment as ordered. Pain has been defined as what the patient says it is, existing whenever he says it does. Some patients can carry on their daily lives with little outward signs of pain, and providers may not believe that the patients are in pain. Some other patients struggle through their daily lives, and it's easily believable that the patient is in pain. That's why the guidelines in the pain patient assessment need to be followed. As healthcare providers, we must collaborate and discuss our own perceptions and put our pain values and beliefs on the table. The guidelines are set up to protect the patients as well as the providers, and this will determine the patient's needs. We need to document, report, and treat the patient's pain. If we as providers assume that the patient pain is non-existent, then we have failed our patients. Patients may look happy, but they want to be good patients, so we don't treat the patients because they don't look like they're in pain. The patients may have a history of drug use, behavioral disorders, psychiatric disorders that may also cloud our judgment. We really need to stress how important it is to be aware of the stereotypical assumptions of pain that is similar to or compared to the traditional nursing values and beliefs. Patient safety and quality of care in pain management. According to the standards, the safety and quality of care are aligned with the organization's mission, goals, and vision. It involves the collaboration of the healthcare team. The takeaway from this project is to provide education for the healthcare staff to advocate for patients and improve the quality with safe patient care. The strategic steps to build or develop a safe culture in the healthcare system. Galatians 6:9, and let us not grow weary while doing good, for in due season we shall reap if we do not lose heart. In a day of a healthcare worker, it is routine and sometimes becomes repetitive. We need to adhere to policies. As Christian nurses and healthcare workers, we need to develop a work-life balance of self-care, such as exercise, eat right, rest, and practice some form of meditation. Developing a sense of self-awareness will provide rest and renewal of the spirit, and we will be able to care for others. The healthcare organization is an acute care community hospital. The presentation will be provided in a classroom with PowerPoint. For those that are unable to attend, the presentation will have available online through the e-education. The target audience identified for the presentation is for the acute care oncology units. The healthcare staff includes registered nurses, associate degree nurses, bachelor degree nurses, nurse practitioners, and physicians. The stakeholders include the patient, family, board member, employees, organization, finance, resources, communities, etc., which can be affected by the actions of the policy and procedures of the organization. It is a challenge to keep the audience's attention, and the example is the generation gap. The traditional generations, the baby boomers, the Generation X, the millennials, or the Generation Y. It also can be a benefit if we know the differences in the attitudes, behaviors, and expectations, habits, motivations, and the ways to communicate with the different generations. The literature review finds the classifications of pain. The variations of pain origin can be peripheral or central or nervous system, the acute versus chronic and referred pain, the cancer pain, and it is important to know all of these to assess and the different treatments. Proverbs 21:13, whoever shuts his ear to the cry of the poor will also cry himself and not be heard. What if someone we love is in pain? It holds true then in Luke 6:3, to do unto others as you would have them do unto you. It is also stressed in the ethical standards in respect to others and their autonomy and their values and beliefs. As healthcare staff, we need to step back and be mindful, to be present in the situation, whether the concern is with patients, family, or staff. The traditional behavior signs are easily identified, but when adaptation sets in, it can be difficult for the provider that 1 minute the pain is tolerable for the patient and then the pain sets back in. This concept becomes a barrier for the treatments and the provider to believe the patient. The physiological effect from untreated pain can be significant and play havoc on the body. The respiratory system, the cardiovascular system, endocrine system, decreased immune function. It also causes psychological effects such as depression, and it can affect the cognitive functioning as well. The organization uses 3 types of assessment tools for a patient to describe the intensity of pain: numeric rating scales, visual analog scales, and the Wong-Baker FACES pain rating scales. Pain has many faces which can be electric sharp and can come and go, and patients have many different types of pain. There are also many different types of medication: opioids, non-opioids, antidepressants, anesthesias, steroids. Some of the side effects need to be managed: constipation, nausea, vomiting, sleeplessness, dizziness, and rash. Cancer pain can be caused by many different factors, and it can originate from the cancer itself, the growing tumor, the effects of the cancer has on the bone, soft tissue, nervous system, etc. There are many different types of medication classes that can relieve the cancer pain. There are also alternatives, methods that can be used for pain, such as radiation, cold, heat, physical therapy, and cutaneous stimulation. Breakthrough cancer pain. It is crucial to assess and document the patient's response to pain and its treatments, to be able to measure the effectiveness of the treatment and the type of pain. Report to the physician any changes in the patient's pain for further orders, such as an adjustment of medication, dosage, type of medication, or any further treatments or evaluations, because the pain can be an oncological emergency. When pain is not managed, it becomes an ethical issue. The health team is responsible to assess, identify, and provide a plan for treatment. The timeline is to guide the project to meet a 3-year goal. During this time, there will be a schedule, updates, meetings, and evaluations quarterly and biannually. The staff will be closely involved with their feedback and evaluation of the process in weekly huddles and monthly meetings. This will ensure sustainability and any recommendations to meet the goals of the organization and compliance to earn accreditation. Collaboration and communication for improvement in pain management. The methods of communication are formal and informal. The modes of communication are verbal, written, and electronic, and can vary throughout the process. But both formal and informal communication must take place to support the sustainability of the process. They will use PowerPoint, email, meetings, morning huddles, and committee meetings. The financial budget process. Every project affects the budget positively or negatively. This program is cost efficient using the PowerPoint presentation. The cost of the paper, ink, and the time included in the huddles and meetings that are already in place. The education process is easily incorporated into activities as an addition to pain management education during the annual updates and new hire orientation. The ANA Standard 6 states the nurse administrator evaluates the strategic plan that provides a way to measure the process to improve the professional performance. The evaluation results using the nursing process will inform the stakeholders of the effectiveness of the program process. An evaluation audit can be done internally or externally that demonstrate evidence for the organization processes. The detailed data will determine the status of the process, billing, material, payments, equipment, utilization, operations, and human capital. Another evaluation method is by developing dashboards. This will provide measurement to follow the process in the plan. Also, the internal audits are methods that provide information on the progress. This allows the evaluation to determine any further recommendations for improvement in the process. As the parable reveals, the nurse leader can guide the staff through the pain management process to ensure the care of God's people. The parable speaks to me that if one sheep is lost, then go until it is found, and we will rejoice in the care that we can provide for God's people. In Luke 15:3-7. Any questions? References. Thank you.